pn14. Q. The licensed vocational nurse may not assume the primary care for a client. A. In the fourth stage of labor. B. 2 days post appendectomy. C. With a venous access device. D. With bipolar disorder. Rationale. The licensed vocational nurse may not assume primary care of the client with a central venous access device. The licensed vocational nurse may care for the client in labor, the client post-operative client, and the client with bipolar disorder. Q. While caring for a client following a Whipple procedure, the LPN notices that the drainage has become bile-tinged and has increased over the past hour. The LPN should A. Document the finding and continue to monitor the client. B. Irrigate the drainage tube with 10 megaliters of normal saline. C. Decrease the amount of intermittent suction. D. Notify the RN regarding changes in the drainage. Rationale. The appearance of increased drainage that is clear, colorless, or bile-tinged indicates disruption or leakage at one of the anastomosis sites, which requires immediate attention. Answer A is incorrect because the client's condition will worsen without prompt intervention. Answers B and C are incorrect choices because they cannot be performed without a physician's order. Q. The physician has ordered dolafene methadone for a client withdrawing from opiates. Which finding is associated with acute methadone toxicity? A. Fever. B. Oliguria. C. Nasal congestion. D. Respiratory depression. Rationale. Methadone is an opiate agonist, therefore, it is capable of producing respiratory depression. Q. Which technique should the nurse use to prevent air from entering the stomach during a nasogastric tube feeding? A. Pour all the formula into the syringe barrel before opening the clamp. B. Open the clamp and pour the formula in a continuous flow down the side of the syringe barrel. C. Release the clamp before pouring all the formula into the syringe barrel. D. Open the clamp and allow a small amount of formula to enter the stomach before adding more formula. Rationale. To prevent air from entering the stomach, the nurse should pour all the formula into the syringe barrel before opening the clamp. Answers B, C, and D are incorrect because they do not prevent air from entering the stomach during nasogastric tube feeding. Q. The doctor suspects that the client has an ectopic pregnancy. Which symptom is consistent with a diagnosis of ectopic pregnancy? A. Painless vaginal bleeding. B. Abdominal cramping. C. Throbbing pain in the upper quadrant. D. Sudden, stabbing pain in the lower quadrant. Rationale. The signs of an ectopic pregnancy are vague until the fallopian tube ruptures. The client will complain of sudden, stabbing pain in the lower quadrant that radiates down the leg or up into the chest. Painless vaginal bleeding is a sign of placenta previa, so answer A is incorrect. Abdominal cramping is a sign of labor, so answer B is incorrect. Throbbing pain in the upper quadrant, in answer C, is nonspecific and is not a sign of an ectopic pregnancy. Q. Who is credited with the stages of cognitive development? A. Erickson. B. Piaget. C. Freud. D. Lister. Rationale. Jean Piaget is credited with the stages of cognitive development from infancy until the age of 12. Erickson developed the psychological stages of development and their correlate developmental tasks from infancy to older age. Freud developed the psychological stages of development. And Lister is considered the father of infection control and the person who discovered antibiotics. Q. The client is having electroconvulsive therapy for treatment of severe depression. Which of the following indicates that the client's ECT has been effective? A. The client loses consciousness. B. The client vomits. C. The client's ECG indicates tachycardia. D. The client has a grand mal seizure. Rationale. During ECT, the client will have a grand mal seizure. This indicates completion of the electroconvulsive therapy. Answer A is incorrect because clients are frequently given medication that will cause drowsiness or sleep. Answer B is incorrect because vomiting is not a sign that the ECT has been effective. Answer C is incorrect because tachycardia might be present, but it is not a sign that the ECT has been effective. Q. Your pediatric weighs 15.8 kilograms. How many pounds does this child weigh? A. 36 pounds. B. 35 pounds. C. 33.6 pounds. D. 34.8 pounds. Rationale: since there are 2 pound and 1 kilogram, you calculate the weight in pounds by multiplying 2.2 by the kg weight as below. 15.8 kilograms x 2.2 equals 34.8 pounds. Q. The nurse is assessing a multigravida, 36 weeks gestation for symptoms of pregnancy, induced hypertension and preeclampsia. The nurse should give priority to assessing the client for a. Facial swelling. B. Pulse deficits. C. Ankle edema. D. Diminished reflexes. Rationale: the nurse should pay close attention to swelling in the client with preeclampsia. Facial swelling indicates that the client's condition is worsening and blood pressure will be increased. Answer B is not related to the question, therefore, it is incorrect. Answer C is incorrect because ankle edema is expected in pregnancy. Diminished reflexes are associated with the use of magnesium sulfate, which is the treatment of preeclampsia. Therefore, answer D is incorrect. Q. Which of the following diet instructions should be given to the client with recurring urinary tract infections? A. Increase intake of meats. B. Avoid citrus fruits. C. Perform pericare with hydrogen peroxide. D. Drink a glass of cranberry juice every day. Rationale: cranberry juice is more alkaline and, when metabolized by the body, is excreted with acidic urine. Bacteria does not grow freely in acidic urine. Answer A. Increasing intake of meats is not associated with urinary tract infections. Answer B is incorrect because the client does not have to avoid citrus fruits. Pericare should be done, but not with hydrogen peroxide, so answer C is incorrect. Q. The licensed